Hi, this is Marie-Chantal from Tinnitus Therapy Online, clinical audiologist and tinnitus specialist. Today we're going to look at some common causes of tinnitus. You may think that tinnitus is solely an auditory disorder. However, this is not quite correct. In many people, tinnitus is not only an auditory disorder. It can be caused by one or a combination of other conditions. Let's go through them. The first thing to look at is your hearing. So if you do have a sensory neural hearing loss, a common cause of tinnitus is inner ear hair cell damage. Those tiny delicate hairs in your inner ear move in relation to the pressure of sound waves. This triggers cells to release an electrical signal through a nerve from your ear to your brain. That nerve is called the auditory nerve. So when your brain gets this signal, it interprets that as a sound, and that's how you hear. If the hair cells inside your inner ear are bent or broken, they can leak random electrical impulses to your brain, causing what you know as tinnitus. Number 2, exposure to loud noise. Loud noises such as heavy machinery, chainsaws, firearms, or explosions are also common sources of noise-related hearing loss. Listening to music in headphones at a loud volume can also cause noise-related hearing loss if it's played loudly enough for long periods of time. Tinnitus caused by short-term exposure, such as attending a loud concert, usually goes away within 24 to 48 hours. However, it can actually last longer, and that can be a problem. Both long-term and short-term exposure to loud sound can cause permanent hearing damage and a side effect of tinnitus. Number 3, earwax buildup. So earwax, although quite disgusting, it actually has a purpose of protecting your ear canal and trapping dirt from going further into your ear. When too much earwax accumulates, however, it becomes too hard for itself to ease out naturally. This can cause a temporary hearing loss or the irritation of the ear canal and eardrum, which can also lead to tinnitus. Number 4, ear bone changes. So we have little tiny bones inside the middle ear called ossicles. The stiffening of these bones is called otosclerosis, and that may affect your hearing and cause a side effect of tinnitus. This is an abnormal bone growth, and it tends to run in families. 5, Ménière's disease. So tinnitus can be an early indicator of Ménière's disease, an inner ear disorder that may be caused by abnormal inner ear fluid pressure. 6, TMJ disorders. This is covered in an earlier video of mine. So problems with your temporomandibular joint can cause tinnitus. 7, head injuries or neck injuries. Head or neck trauma can affect the inner ear, hearing nerves, or brain function linked to your hearing. 8, acoustic neuroma. It's important not to panic here because this is very rare. However, it is a causative factor in some cases, so I'll have to mention it. This is a benign tumor that develops from the balance and hearing nerves supplying the inner ear. This condition generally causes tinnitus in only one ear, so it's important to get to an ENT to rule this out. 9, muscle spasms in the inner ear. So muscles in the inner ear can tense up or spasm, which can result in tinnitus, hearing loss, and a feeling of oral fullness or fullness in the ear. This sometimes happens for no reason, but can also be caused by neurological diseases, including multiple sclerosis. 10, blood vessel disorders can be linked to tinnitus. So the type of tinnitus would be called pulsatile tinnitus, whereby your tinnitus sounds like a heartbeat or as a rhythmical sound that is in sync with your heartbeat. Vascular disorders to look out for are high blood pressure, hypertension, factors that increase blood pressure such as stress, alcohol, and caffeine, which can all make tinnitus more noticeable. Turbulent blood flow such as the narrowing or kinking in a neck artery or vein in your neck. And any vascular disorder that can cause turbulent, irregular blood flow can lead to tinnitus. In summary, you should contact your physician to assess your vascular health. Certain medications can cause tinnitus. You'd be surprised at how many people see me with a long history of medications, sometimes 5 to 10 pills per day, without realizing a possible side effect of some of these is in fact tinnitus. My recommendation to you is that it is your responsibility to check whether tinnitus or hearing loss is a side effect of your medication. Unfortunately, when you go to see a medical practitioner in an appointment for a certain issue, they will rarely rattle off all of the side effects if he or she is treating an immediate primary concern of yours. So here's the thing. A number of medications may cause or worsen tinnitus, and generally, the higher the dose of these medications, the worse the tinnitus can become. Things to double check in particular are antibiotics, cancer medications, water pills, some antidepressants, and high-dose aspirin. I should mention, let's not forget the influence of stress in your tinnitus. I will cover this in more detail in a future episode because it's such a huge topic. But for now, I hope this helped you.